Hello, I'm Dr. Peter Zelles. This is fourth in a series of videos on COVID and mental health. It's December 2020. We're on the verge of having a vaccine released to the American public. And in some ways, things are looking positive. And yet, we're talking about lots of mental health problems right now. People are suffering at the moment. A lot in the newspapers about it, a lot in the news. I'm sure you're reading about it. And one of the questions is, what does that mean? Why are we having mental health problems, and what does that look like? Most of us don't think of ourselves as having mental health problems, but it can be subtle. And in the time of a worldwide pandemic, it's not unlikely that people would be suffering in a number of ways. One of the interesting things about this is we ask people how they're doing, just casual conversation. And it's interesting what we hear and what we say ourselves sometimes, that at any given moment, we might say, you know what, I'm doing remarkably well. I think I'm really handling this well. I'm doing great. And then 15 minutes later, we may be asked the same question and saying, I can't stand this anymore. I can't take it for one more minute. There's this incredible lability that we feel, that where one moment we're doing great, the next minute we can hardly stand it. And one of the interesting things about that is that we're probably experiencing near depletion of our psychological resources all the time. If you think of psychological resources as like a gas tank that keeps us going, it's nice if we have our tank full and we have lots of distance we can go, lots of resources to use. And for most of us right now, we're going toward empty all the time. And we may fill up a little bit and suddenly feel like, wow, I got a lot of resources. And then that drains out really quickly and we're sucking air, as we say in the car business. And, that's a difficult thing. That lability itself is tremendously difficult. So one of the things that contributes to that, interestingly, is this pandemic fatigue, is something that people are calling decision fatigue. We have to make important decisions every day, and decisions that used to be simple. We hardly would think about them all. We're thinking about them in serious ways. The decision whether to go to a store or go to visit someone in a socially distanced gathering suddenly becomes a medical, moral decision. Should I really go to the store? Do I want to take that risk? Should I see this person? Maybe that's not a good idea. Much less big decisions like traveling to see people across the country or go home to visit family. These are all huge moral decisions because we might spread the virus or we might get the virus ourselves. And that kind of decision making itself, tremendously difficult. Very, very hard for all of us to deal with. Another interesting part of that is that a year ago, if people wanted to get together and go for a meal together or a visit, I would say there's nothing better they could do than that. I'm an attachment-based psychologist. I believe that one of the great things we can do as human beings is connect. That's probably what we're born for. And now what we're saying is, don't do it. Don't get together with people. In fact, it's dangerous. And we even find ourselves looking down on people. I know I do. I see news reports of people going to restaurants and things that are dangerous. And I think those people shouldn't be doing that. Feel very virtuous about it at the moment, as though I'm virtuous, I'm not going to get sick, but those people are bad. What some people refer to as virtue signaling. It's interesting because we would have said that was a great thing to do just a year ago. Now it's suddenly this terrible, dangerous thing. It's going to be a good thing again, even though it's dangerous right now. So we have to deal with that and think about all these decisions that are so hard for us all the time. It's worthwhile just to know that we're having to make those decisions all the time. And it really is hard. It's harder than it normally would be. Again, just the decision of going to the store can be tremendously difficult for people. So give yourself a break. This is a hard thing. We have to keep this up for a while, even though we're on the verge of a vaccine. It's important that we keep up those special tasks that we're doing to keep ourselves safe. Social distancing, wearing masks, all those things are important. It raises the question about science, because one of the things that was talked about a lot in the recent political arena, and certainly in the paper every day, is trust science, that we should be trusting science about this. That makes sense, but it's not as easy as that, is it? Because science changes, it adjusts. The nature of science is not black and white. It isn't that way, it changes. Anyone who's ever gone through cancer treatment or knows someone who has or was close to them knows that the best oncologists you'll meet are the ones who will say, this is what we're doing today, we think this is a great idea, we might change our mind next week, because science grows and adjusts over time. In a pandemic, dealing with a virus that's new to us, the information that we have about it is short. We don't know as much about this as we'd like. What we don't know about how this virus is spread is a lot. So the recommendations seem to change, and you will find what seemingly conflicting science or science that's different from one study to the next. That's the way it always is. We try things out in science, we have hypotheses, and we test them. And the hypothesis might be great. All the background information about it might sound like this is the thing you should do. This drug is the one that's going to work. This is going to block the virus in some way. We've heard that a lot of times about different medicines during this last few months. And then it gets tested out and we found actually it didn't work that way. That's the way science is. We have great hypotheses, we test them out. Either they're proven or they're disproven. Or we learn something new that takes us in a new direction. So as much as we would like it to be just black and white, or we hear about a new medicine and everybody wants to take it, it hasn't been tested yet. And even though it sounds great, it might not be exactly what we need. That's why we need to be cautious about these kinds of things, but also be thoughtful about the fact that, yep, we pay attention to science and we realize that science will be adjusting on this all the time. It's not going to be perfect. One of the dangers about this is that when people want to throw the baby out with the bathwater, well, you can't trust this science. They say one thing, then they say another. Well, if you look at it carefully, you'll find that generally there's an advancement that's moving on, it's happening, but it isn't black and white. And that is a challenge for us. As humans, we'd kind of like things to be simple and black and white. And most of the time, they're not. They're not black and white. So we have to deal with a certain amount of uncertainty, and that's hard to live with. So I really encourage you to be thoughtful about that. Yes, pay attention to the science. Yes, follow the best recommendations. Also realize it will adjust over time. That's what's going to happen. Oh, the big controversy about wearing masks. Are masks perfect? No, they're not. Do they help? Unquestionably they help. Does social distancing help? Absolutely it does. Is it perfect? No, it's not perfect, but it's better than not doing anything. So again, it's not black and white. The black and white is lock yourself up in the closet and never come out again, and that's not a reasonable option. So we do the things we can do with the science we have. We try to maintain flexibility about it. It's really great that we're close to a vaccine coming out, and that's the hope we've been waiting for a long time. People are going to start getting it very, very soon. And we need to think about the fact that we have a length of time in front of us. It's not going to get distributed to everybody right away. It's going to be slow. So, like I said in the last video, recalibrate. We have to recalibrate. We have to think about this in terms of how many months is this going to take. It's going to take a while. It's really hopeful to know that there's a vaccine out there, and that hope really helps, keeps us moving forward. But also realize we still need to wear masks. We still need to social distance. We still need to limit the kind of contacts we have. Be careful about sanitizing and washing hands. All that basic stuff is really important. We can't stop doing it. So fight on. Take good care of yourselves, which means you'll be taking care of the people around you if you're careful in that way. So that's great. That's great advice. I look forward to talking to you again in the future and looking hopefully toward the future.